sometimes they made good and not so good decisions. I want to remind you that all the arguments you heard tonight about equality and how important it is that everybody feel good about whatever they do, no matter what it is they do, really doesn't make much sense when it comes to a habit which is so captivating and so destructive and so antisocial. Now, on the one hand, about toward the end of the 70s, I remember giving testimony of this sort, and as I said, sometimes legislators went along and sometimes not. When the decision was made to free gays to donate blood, to be treated just the same as others, when the decision was made to free the whole mental health and physical health system to accept homosexuality, it sounded good, sounded safe. But now we live in a world in which 300,000 U.S. gays have died because of their habit connected with HIV. We're paying this tax because of their HIV. If you look at the total cost borne by every family unit in Colorado, certainly somewhere near $1,000 a year paying for homosexuality. When it was said and when it was warned 50 years ago that the celebration and acceptance of homosexuality would dampen marriage, many scholars scoffed. A lot of sophisticated people scoffed. We are now in a society in which marriage is declining, and if you pass this bill, it will decline further. It sounds plausible. Surely people ought to be able to do what they want to do. But this happens to be the kind of activity, the kind of a taste that, in disagreement with Representative Kagan, people can abandon, do abandon all the time. Other people pick it up. If we as a society allow it to be accepted, we'll get more of it. As has been testified, more and more kids seem to be interested in this activity. A sensible society always asks people to direct their sexuality in such a way that it doesn't harm, but in fact helps procreate society. If you vote otherwise, you are going to help end, not tomorrow, the sun will come up, but you will help to end this most successful civilization.
Thank you, Doctor. Are there questions from the committee for Dr. Cameron? Dr. Cameron, I have been puzzled. I read your press release, but I guess I want to, you've talked about the cost of HIV/AIDS, and this bill is about civil unions, and I'm not certain that one might choose a particular behavior based on whether civil unions are available. In fact, the evidence I've heard is that because people have a particular sexual orientation, they, which I presume means that they would engage in particular activity, but because they do have that orientation, they would like a civil union. And so I'm having trouble making the connection between whether the bill is going to cost us more money or not. And I guess in furtherance of that, there may be those who would argue that because a civil union might lead to a more committed relationship, I don't know if that's true or untrue, but I've certainly heard that argument here today, that that more committed relationship would lead to less promiscuous behavior and therefore would lead to less AIDS. So could you address that general issue?
Yes, the evidence is very clear that when gays are partnered, they're more apt to get sexually transmitted diseases, particularly bloodborne diseases such as HIV. So if you encourage them to partner, you will encourage the spread of AIDS or HIV. Now, if in theory people were perfectly, let's say, committed to one another and didn't fool around, if that existed, and they both started in their relationship not infected, well, obviously obviously they couldn't get infected. As a matter of fact, when you look at, and there's quite a bit of evidence now published throughout the literature that suggests that committing to homosexuality, even a person, is also associated with high levels of promiscuity. Very, very intimate relationships from a biological standpoint with a partner, and intermittent, very intimate relations with others. This is certainly the case with men who engage in homosexuality. It's a different pattern with women. But if you pass this law, you will encourage more of those fellas with homosexual inclinations to engage in more frequent intimate activities, which I presume you don't want to specify. But there are certain kinds of activities, especially anal, penile sex, which is highly associated with getting HIV. So this will actually increase the costs of this disease. And the question is, why do you want to give a further benefit, a further encouragement to people to engage in homosexuality when our society right now is in desperate need, certainly the West as a whole, of children, preferably children raised in a mother and a father situation?
Thank you. Are there further questions for Dr. Cameron? Seeing none, we thank you for being here, Dr. Cameron. Have a good evening.